So, the House of Free Fates presents The Buzz from the Treatment Table, and we have a very special guest with us today.
Oh, you're my guest. Always I'm not your guest, but it's fun to be with you, June, and congratulations on your first podcast.
Yes,
That's what I'm gonna call it.
our first episode.
And for the upcoming opening for your new business,
Thank
I'm
you.
very proud and happy for.
Oh, thank you so much. So, I had worked with you for the last decade. Yes, 10 years. And no, that's crazy. And I've seen the majority of your postoperative patients free. Done all your body contouring and your postoperative patients doing the treatments for you. And you did an excellent job doing surgery on my own family and friends. So I want to welcome you.
Yeah, it is. Thank you, thank you. And June has been around more than 10 years.
Yes.
June been doing aesthetic medicine and helping people with their goals for almost 20,
Yeah,
20
20
some,
some, yeah, 25
25,
something
20
years.
years and well known in San Diego area. With the big surprise, she knows even everybody in town, like, wives or well, players I just learned, correct? You remember?
Yes, I do.
She's known with the community and she knows stars. And on top of all that, June knows a lot about aesthetics. She is described to be welcoming, friendly, and honest with all my patients that always I refer to you. So I'm happy to be here on your podcast.
Thank you so
So shoot it up. Let's see what what are you gonna do and have those people learn.
Thank you. Well, I want to know about you. So, what inspired you, do you think, to become a cosmetic surgeon? What inspired you?
That's a loaded question. It's let me think about it. I mean, I cannot say what inspired me. I think it's cumulative during my whole entire life.
Yeah.
I didn't like one day come up and I want to be a cosmetic surgeon. Things change in life and you evolve. But I probably would say my mother.
Yeah.
My mother stopped teaching me how to sew. She's an artistic lady and she loves beauty and she always wanted to look nice and pretty. And I always watch her how she does things. So I think she built a lot of that in my personality. She's an architect, so and she's an artist as well. She draws, and that probably brought this artistic part in me. So that's when I grew up and then how did I become a doctor before saying become a cosmetic surgeon? Because as I said, this is something usually evolves and comes with life. I had something sad in my family. My sister died at an early age, and I decided I wanna cure cancer. Unfortunately, she had cancer, and I said, you know what? I'm becoming a doctor, so I wanted to cure cancer and you go through the process, medical doctors, schools, and then when you're in school you start loving things. Surgery became something that I loved, and I have good hands and I was very good about suturing, helping in surgery, because when you're a medical student you go and you experience all type of medicine, and I really enjoyed it, and I decided that I would become a surgeon. And during that training period when I was training for surgery, ah, the artistic part came along, and that's when I started feeling like I could be an excellent person in that field, including my personality, how I look things, my techniques are very handy. I do things very meticulous, and all that came along, and that specialty became my thing in that. So that's how I became cosmetic surgeon.
That's awesome.
So does that answer your question?
It does.
It's
So
loaded.
it was. It was over. So, how have you watched it evolve over the years? How have you watched cosmetic surgery evolve?
You mean the field of
Yes.
cosmetic surgery? Oh, this is what we're in now is nothing like I used to be in the past. And even the type of surgeon changed. We became more artistic than before. In the past, it was a new field that surgeons just wanted to do, because it was a new thing. Um, and they laid it down the basic science of it wonderfully. So not this uh, credit them at all. I mean, they build a fantastic field of plastic cosmetic surgery. But over the years, what happened is technology as well as education and how popularity became made things evolve as an amazing science. Okay, so we don't do anything now is just because we wanted to do it. It's so we can do it. It's there's always very good studied, performed techniques that we go after. And recently, of course, technology and lasers, new techniques, even the AI is helping us now with getting to things in much better fashion to really establish very good results. So it's continuing evolving specialty. I love it. It keeps me on my hands and toes because I have to always keep up with what new coming up. And we're in an age now with those everybody knows about everything. And we're not only the only one podcast that talking about this, so you have to be on top of everything. So
So what procedures are trending right now in 2025? Like, I think a while back you were telling me like everybody wanted the Instagram face. So, or do people still want?
do you remember that when we talked about this? When Instagram and Facebook,
Yes.
came along and became a very social need for everyone. We wanted to look good,
Next.
right? And COVID came along, and that made people want to look even better. So people switched to their social activities online, even their meetings and work online. And people would look at themselves in the camera and they said, "Oh my gosh, like you make sure you got my facial corner good. I want to look good. Is that good spot? Is that like so?" People started want to do Instagram face. They want to look the best in reality, and a lot of people now use even little touching, to make it look better in camera. But it became very important that you had the young, healthy, flourish. Appearance because we're on our phones and in front of cameras most of the day now.
Yeah.
So that's what the Instagram.
And they're always pretty.
There's man, we're gonna call it a different name. We're gonna call it the podcasters
The podcast face.
to make sure it will be look good.
Yes.
Yeah.
So do you think younger patients are seeking more cosmetic procedures or they're knowing more and they're asking more questions?
It, I think it's been like that. For years, we had all the Botox filler, minimally invasive stuff, lasers that young people always wanted to do. So this is still continuing to be the same. So we always had younger people come to practice to get some type of uh, aesthetic procedure, like even facials, like what your new business is. Everybody now wants to do their nails, their toes. They want to always look really nice. So it's been there, but now it's becoming more advanced, and there's more choices for people. So you have more to pick from and do things. But what I'm noticing now that they are more open to the surgical procedure than just the minimally invasive. A lot of younger generation will come and wanted to do some surgical procedure that they're simple, not very invasive, but enhance their beauty. Or trying to do something to they're afraid of getting older. They look at their mom or aunts when they started looking a little older at the age of 40 now. They want to stay away from that. They want to do something that I want to not go through that process when my mom and my aunt start talking about their facial aging for 10 years after before they go and do something. Now people are becoming more educated about you probably can do things that can prevent you to get to that we're all going to age at the end of the day, but with the newer techniques now we can slow that process or extend the time that you're looking older. So Yes, I've been seeing a lot of more younger age population wanted to come and do some cosmetic procedure. Again, everybody likes to do the Botox fillers, facials, you know, body contouring things with minimally invasive laser stuff. But we're seeing more surgical stuff too.
So, what do you feel is the most popular procedure that you do?
Oh my gosh, it's
Because you do everything.
yeah, I do everything. I'm gonna keep it in a very straightforward, especially related to what you do, Julie. Is your um, uh, day per day. You work on people faces with your lasers, and now with your facial treatments, skincare. Um, so we been noticing recently huge influence of facial procedures for young people or even for older people, like mini facelifts,
Yep.
brow lifts, eyelid surgery, bags under the eyes, the turning of the chin in area, or even augmenting the cheek or the jawlines. So we're seeing more of that. Of course, rhinoplasty is very um, odd procedure, but the buccal fat, now it's buccal fat is becoming very very popular. The deep plane mini facelifts, everything that has minimally invasive techniques that can get people through the surgery with smaller scars, with less recovery time, is becoming very popular. And we have a lot of those new techniques now, and like, brow lift to open the eyebrows area, this procedure that we do it with tangular cuts. Okay. And people recover out of it very well. The deep plain facelift that pulls your jaws a little bit, pulls your mid face up a little bit. Um, we can do those with very so what's minimally invasive? Minimally invasive is when you do tiny little cuts of the skin. You don't have to do the big cuts, and your work area, what we call it dissection area, is very limited, so you're not causing a lot of trauma, or not trauma, like you're not playing a lot with the tissues. You're picking up on specific area that you want to work on and improve the rest of the look, and that makes a big difference to what we used to do when we go really deep and do a lot of stuff, that we are keeping the natural look. And that's what people want. They want to do something that, what, I don't want to change, I just want to look more refreshed. That's what I get all the time. And that's, so again, buccal fat, deep plane facelifts, endoscopic brow lift, that's for facial procedures. Those are very uh, common, not common, or asked about procedure, even with ladies in age of 30s to 40s. Okay, younger girls with, more implants in the chin or cheek or jaw. For body stuff, the 360 liposuction is big. People want to trim in the middle, look hourglassy, with minimally invasive lipo procedures. And then we do a lot of massages and lymphatic drainage and laser treatment to enhance that and makes the recovery much faster. Big thing now, that's what you do, and you're great at it. Oh my gosh, you can fix a lot of problems. Um, and a big thing now, we probably, you and I, we never talked about that. I just heard and been researching, and I'm most likely we're gonna go and get trained in it, because that's what I'm talking about. We always like to evolve, right? Now, uh, um, the era when everybody wanted to have the bigger butt for Brazilian butt lifts, right? Oh, everybody wants to do that. And what happened with that is we came to a point that everybody looked like, you go to the mall and you see those girls, like,
Yes. Well,
like,
you knew who
I
had.
know.
You definitely knew who had.
So yeah, now it's and what happened is, to fix the problem with the butt, the doctors had to put a lot of, Brazilian butt lift is adding fat to your butt. So you're transferring fat to the butt.
Yes.
and to be able to get and give that nice shape and get rid of the loose skin or lift the butt, because it's called Brazilian butt lift. Surgeons sometimes have to put a lot of fat in to give them that enhanced
So you
look
would
they're
take it
looking.
out from all the areas.
And what happened as well is they became huge butts. And people now, they don't want to really have that humongous butt anymore. So there's the new techniques to be able to reduce the Brazilian butt lift a little bit and deal with that loose skin that happens after you go that big. If you're gonna get a little smaller, then you're gonna end up with the loose skin. It's like when you inflate a balloon and you keep it inflated for a long time and you deflate it, you're gonna see all the wrinkles. Right. So a lot of people are getting into that, the cellulite. So there's the new things now about really not really adding too much volume to give that nice rounded look of the butt. Is to put some volume, but then do other lifting procedures, minimally invasive, to lift the butt. Like, a lot of people have little squared look butt or tiny little bits of another butt underneath, and you want to lift that up, right? So there's this now called the thong lift. The thong lift is done through tiny little cuts that you hide it with your thong bikini and lines. So the scars are hidden. It's minimally invasive, and you can pull the skin and make the skin look nicer and more easier. So that's a big thing. The thong, it's called the thong lift, 360 lipo.
Right.
Um, uh, and those are the two major things for now in the 2025s that people are talking about.
So do you think that celebrities drive this? Like people see celebrities' houses?
Eh, Oh, we live in the area that everybody wants to look celebrity.
Yes.
You look at
Kardashians or
and that's the trend. Like, it does influence every business and every aspect of our life. And celebrities, the new celebrities, the new boom of TikTokers, influencers, those have become celebrities. And they influence their opinion to people, and people get attracted to that, and they want to be the same. So yes, it does influence, and most of the time is for the good, especially if things are coming from around us, like California, United States. It's believable more than unbelievable.
Right. So, how do you help the patient set realistic expectations, like about themselves? Like if you have a consultation and they want something that's not realistic to, their body type, or maybe they have to lose a lot of weight first or
That's a very, very, very important question. Expectation is what we thrive for, and to reach that, it's our bring it up or bring it down kind of scenario. And what I phrase that question is how people will build their expectation. Don't believe everything that is online. Don't believe anything you see in pictures or on Instagram or social media. A lot of it is not real. Okay, so unfortunately, that has to start from there. As a person, when you're looking at things, and I tell my kids that all the time, it's nice to explore and know and hear about it, but you really do your research. And don't, even if you do research, don't always keep yourself a little bit less excited about it, because a lot of these things are not real. So you need to really filter it. And if you get to a point that you're really not knowing what's the real and what's not, then you need to go to an expert. So consultations, coming to see you, like, about you're the expert in skincare. You know exactly what needs to be done for the situation. So, but a lot of time people come in now and they diagnose the problem and they did the research about what needs to be done, but you are supposed to be the treatment person that or give the treatment. But in reality, you should be still as an esthetician and provider. You're the one who really advise and set the expectation. So we do a lot of setting the expectation. Is very important, because we get a lot of clients that they come in and they think they're overeducated, but they're not actually. They're misled, and you have to spend time with the clients, explain to them what's the situation, and hopefully you'll have enough time to do that to really educate them. And we're with doing podcasts and stuff like that. It's very important for religion people talking about what they know. So
So, would you say that there's noticeable differences because um, are there noticeable differences here in the US versus in other countries of cosmetic surgery? Like,
that's an amazing question, and thank you for asking this question, Kika. Uh, I'm not from United States, and you notice my accent, and you know that I'm Yazidi.
I know there. As I
I'm Middle Eastern, okay, and I came to America or to United States to learn medicine because it's the best country in everything. Okay, and why am I saying this? It is the best place because nothing can be done in mass on mass like to popularize it unless if it's really studied, tried, and proven to be good. Okay, especially in medicine. We cannot just like one day Dr. Kouli come out the office and says, "Oh, I found it," and just by doing the procedure. That doesn't work here in the United States. Everything is controlled, everything is very well studied, and we follow guidelines. Otherwise, you will never make it in any business, right? So that's what I believe. That's the only thing about social media that I tell people to be careful, and especially for international clients that we have a lot of in the United States, especially in California, because what happens is you end up following people from all over the world online, right?
yeah.
Or in social media. And you will see this person that giving you a wonderful picture about something, okay? But do you really believe that's it's true? Is it good? Is it really lasting? Especially in cosmetic surgery, you can make a lot of videos and a lot of take a lot of pictures and say, "Oh, I did this fancy procedure of the face. I can do that," or body work, but is it really real? So a lot of times we get a lot of clients and people coming for consultation international or even Americans. Oh, I heard of this and this. I want it, and you tell them that yes, I heard of it, but I'm not gonna offer it because I don't know what's the end results of this, or is it really good, or so some people end up going to those places and getting it done, and I believe it's disastrous because you don't know what you're getting. Number one, number two, you're not living in those areas when you go to other countries to do procedures. So if you get into complication, let's say even if you go to an expert, you say that I go to an expert in so and so country. Oh yeah, okay, you did proceed on an expert, and you did fine. Good luck, beautiful. But the next patient who gets into a problem and you're now 4,000 miles away from that expert in the country that we don't do this or we didn't take care of this problems, how are you going to go back to that person to take care of the issue if they know how to take care of it anyway? So don't believe everything in social media. There's a lot of things online we see from expert of the words. They could be. I'm not this claiming them, but just be careful and um, always hear everybody wants to be in California and United States to learn about the new things, and we know about the new things always. We're the first to do the safest, newest practices in the world. So I would always trust people from around here and be careful about going somewhere else.
That's true. So, what do you think is the most unusual or surprising request you've ever gotten? Like
From
from a patient?
awesome fishing kit. I get weird
I know. You're
impression.
professor
My kids all day long and my wife, and so you're talking about
patient, yeah.
that's the same thing than what I told you. Like you know
Why would they canterbury?
the first time I heard about the the salmon sperm,
Yeah.
which is could be true. And they're studying now. It's not FDA approved in the United States. The first time I heard about it 3 years ago or 4 years ago, I'm like, what are you talking about? Gonna put sperms on my face to look better, but there it's coming along. It's something that probably gonna be uh, offered in the United States after FDA approval. I'm pretty sure there's people are getting it now in the United States, including uh, celebrities, which has been studied in different places, and then so we hear a lot of funny stuff. Uh, I mean, there's crazy stories. I'm not gonna be on podcasting.
No. Yeah.
So we'll keep it low,
Right.
buddy. Okay, so please.
Of course. So what advice would you give to someone considering their first cosmetic procedure? Like if they'd never had anything done?
Go to the professionals. Don't listen to online or Instagram or Google or whatever broadcast, even my broadcast. Just kidding. Just ask for a friend or family member if they ever had this. Who do you trust? Who's the person who worked on you? Like if you had a lady you worked on her 10 years ago in your 20 years career, and the best thing is to ask that client to refer myself to you. Okay, so you always referral. It's the number one. It's trusted person, been tried, family member, friend. Unfortunately, now we live in an era that a lot of people are living by themselves in a new city or new state. So the research to a local person to go and get question about what you are looking for, and hopefully they will be helpful to you. And if you cannot find anybody, you can always come to us.
Yes, you can always.
Julie and Dr. Cool.
Yes. So what's one thing that you wish everyone knew about cosmetic surgery?
You wish
Like if what's something like, for instance, I wish one thing that everybody knew about cosmetic surgery was it's people heal pretty fast.
yes, it's not like how it used to be before when they take those magazine pictures and the people are wrapped up in multiple gauzes and you're sitting in bed forever. It's not.
Unless that.
So it's much more invasive now. The technique has
Like a
tremendous, and yeah, everything is
very minimal.
and people always like get surprised when they come and see me. You're talking about I'm gonna get done and be healed in a
I'll be
week.
back to work in
And
a week. It's like, yeah,
yeah.
yeah.
The other thing I think it's the cost. People sometimes are afraid of the cost
Yes.
because they hear that there's
Not-
cost if it's doing. No, it's affordable in my opinion. It's all about what you choose the right person to go to.
Mhm. Absolutely.
Yeah.
Yeah. So where can listeners learn more about you and your work?
Uh, of course, your podcast. Your podcast are gonna be watched by million people,
Yeah.
and hopefully, I don't have to do this anymore. And you'll be like, that's it. And become celebrities right now. People have to know about my practice. Of course, I want to promote June with her new upcoming amazing business. I mean, June, don't get me wrong, she's been doing it for many years, but she now wanted to have her own business, so I'm very happy for her. And she still work for me, and her business is not my business, and it's called
House of Three Fates, Aesthetic Wellness Center
Yes, and it's located
at 12845 Point Del Mar Way.
in the wonderful city of Del Mar, Southern California, San Diego. And she worked for Aesthetica of San Diego
With-
for the last 10 years, which is my practice, which we are located in the three wonderful locations in Newport Beach, Del Mar, San Diego, and Coronado, San Diego. You can follow me on aesthetica.ccs on Instagram or aesthetica of San Diego.com online. And
You can also call the office at 858-350-8400. And you can speak with Kim, his consultant, and you can set up a consultation at any time. Dr. Kouli, thank you so much for being with me today.
welcome and good luck.
Thank you.
And I'll be happy to be here if any audience reach out for you for more questions or whatever, I'll be more than happy to answer.
Right.
And best of luck.
Thank you. I
Okay.
appreciate you.
Good to see you.
Awesome. Thank you so much for listening to the House of Three Fates podcast. We appreciate you joining us today. We encourage you to stay connected by subscribing, liking, sharing, and following our journey, and making sure to step into your best self with us next time. If you have any skincare inquiries or concerns, we are here to help. You can always send us an email at threefateswellnesscenter@gmail.com or DM us on our Instagram at House of Three Fates. Thank you for joining us, and we hope you'll join us next time.